This video tells you what you need to know about sulfasalazine, which is used to reduce the symptoms of arthritis such as pain, inflammation and swelling, and it slows the progress of the disease. It can be used in combination with other disease-modifying drugs. It comes as 500 mg tablets, which have a special coating to help reduce nausea. This is called gastro-resistant coating, or EN. The dose is usually slowly increased over the first month to reduce the likelihood of side effects. The first week, you take 1 tablet daily after breakfast. The second week, you take 1 tablet twice a day after breakfast and after the evening meal. The third week, you take 2 tablets after breakfast and 1 tablet after the evening meal. And then you continue to take 2 tablets after breakfast and 2 tablets after the evening meal. Swallow the tablets whole with water. Do not crush or chew the tablets, as this disrupts the special coating. Some patients may be prescribed a lower or higher dose than this. If you have swallowing difficulties, it may be possible to order a liquid form of the medicine. It can take 3 months or longer to see the improvement in your condition. Do not take sulfasalazine if you are allergic to aspirin or antibiotics called sulfonamides. A commonly used one is Septrin, which is also known as cotrimoxazole. Blood tests checking the liver, kidneys, blood cells and level of inflammation in the body need to be done before starting treatment, and then every 2 weeks for the first 6 weeks, then once a month for 3 months, and then once every 3 months. After a year, there is no need for ongoing regular monitoring unless your dose is increased. Regular monitoring is important for your safety, and treatment may be stopped if it is missed. Some people experience side effects such as nausea, diarrhea and abdominal pain, which usually settle with time. Headaches, dizziness, rashes and mouth ulcers can also occur. Your skin may be more prone to burning in the sun, so precautions should be taken to reduce sun exposure, such as using sunscreen or keeping skin covered. Urine and tears may turn orange. This is harmless, but may stain soft contact lenses. If you experience any of the following, you should get in touch with your doctor or the rheumatology team straight away. Signs of infection worse than a minor cough or cold, such as a high temperature, fever or severe sore throat. Being very pale, unusual bruising or bleeding, unusual tiredness or weakness, or a severe rash causing blisters, which can be on the skin or in the mouth. Sulfasalazine is not a painkiller, so you can continue to take painkillers with it. If you take digoxin, you should let the doctor know, as the amount absorbed may be reduced by sulfasalazine. Do not take indigestion remedies 2 hours before or after you take the sulfasalazine, as it may affect the special coating. You should have the usual recommended pneumovax, yearly flu vaccines and COVID boosters when appropriate. Sulfasalazine is considered to be safe in pregnancy, but you should discuss with the rheumatology team when you are planning a pregnancy and let them know straight away if you become pregnant, as you will need to be prescribed a higher than normal dose of folic acid. It can also be taken whilst breastfeeding, unless the baby is premature or has jaundice. In men, a temporary reduced sperm count may occur whilst they are taking sulfasalazine, making it harder to conceive. However, this usually improves 2 to 3 months after stopping the sulfasalazine. As with all medicines, you should store them out of reach of children. If you have any other questions, you can contact the rheumatology team by phone or email.